Hey everyone, Dr. Todd here from Gonstead Spine and Wellness. Today I'm going to talk to you about everything you need to know about the normal and abnormal cervical spine neck curve. But before I do that, make sure that you hit the subscribe button so you can stay in the loop at all the awesome content that we will have coming your way about how to stay healthy for a lifetime. So with that said, let's jump into it. All right, so over here I have a side view x-ray pulled up of actually one of our staff, okay? And I'm gonna pull this little plastic spine model so I can show you what we're looking at. We're looking at her neck from the side. And in this software, in this analysis, we have a red line and a green line, and the green line signifies what the normal healthy curve should be, and this red line shows where the patient is at, in this case, where our staff member. And you can see that her neck curve, it's pretty darn close. It's not all that far off. You might look at this and get critical and say, well, it doesn't line up perfectly. There's a lot of little details behind what went into making this line. And really, for all intents and purposes, this is pretty darn close. This is one of the most normal cervical curves that we could find in just shooting this video. But technically, yep, there should be a little more curve. Now, why is that important? Why is it important to have a curve in the neck? Let me show you this on the model. I like to show you on models instead of x-rays. So if we are looking at you from the side, you should have a nice forward curve. If we zoom out and look at the entire spine, because you have to kind of explain the entire spine to understand this, you should have a forward curve in the low back, a backward curve in the mid back, and then a forward curve in the neck. So it forms like this big, beautiful S-shaped curve. The curves act like shock absorbers, so that as you go through life and you bounce you step off a curb or you jump, or just the fact that gravity is pushing down on your spine through your skull and everything, the curves dissipate that compressive force, and it helps keep the discs, which are those little cartilaginous spacers in between each vertebra, it helps keep those nice and healthy. And it helps also remove some of that load going into the bones of the spine, which are called the vertebra. So the curves, in summary, keep your spine healthy. They protect you. They're the first line of protection. You need your curves. That's what they do mechanically. Neurologically, there's a spinal cord in there, all right? And more specifically, like if we look here on this x-ray, up here is your skull, all right? So your brain's in here. Brain continues as the spinal cord, and it runs right through this space right here. So that's behind these vertebra. So vertebra, those nerves come off of a spinal cord, sorry. All right, I'm saying sorry to my plastic spine model. So the spinal cord in there comes out as these nerves. Those nerves go to all different organs and tissues and cells and structures in your body. Now, the spinal cord is supposed to exist with a certain amount of laxity, a certain amount of tension throughout the entire cord, right? Spinal cord is kind of like a bungee cord, I guess you could say, in the sense that if you take a bungee cord and you stretch it, does it get thicker or thinner? It gets thinner, right? If you stretch a bungee cord, does it get looser or tighter? Right, it gets tighter. So imagine what happens to a spinal cord that is being stretched. Do you think it likes that? Do you think nerves function well when they're being stretched, and then it causes compression and causes all these other detrimental forces to the sensitive nerve tissue, your spinal cord? You know, spinal cord is very important. So now what happens is the different curves in the spine, they can cause different forces on your spinal cord. So when you lose the curve in your neck, and this, again, it's a slight loss of curve. This isn't something that I would think is all that bad, because in a second I'll show you some ones that are bad. When you have a fairly normal curve in the neck, the spinal cord is in a relaxed position, right? So that your brain can send energy through there, electrical signals, it can go out through all these spinal nerve roots right here. And then I'll show you, like over on this right here, you can see then what happens is that energy from the brain comes out through the nerves, connects to every single cell, tissue, and organ in the body. So all of this stuff out here is totally dependent on the energy from your spinal cord to keep you alive and healthy. And ultimately that's depending on your brain to be able to communicate to the organs and the tissues and everything else. So super, super important to have proper function and proper neurology going on in your neck. And a lot of people don't realize this, but it starts with the curve in your neck. So you have to understand what's normal. That's what I'm getting to, but I wanted to lay down some of the foundation of what is the curve? Why does it matter to begin with? Do you know what your curve looks like? Should you? How do you find out? So with that said, this is what it looks like in the side view. Should have a forward curve. Again, this is the front, this is the back. So like teeth are over here. And in that curve, there's structures that we're looking at pretty simply on x-ray. This is the bone, so this is the vertebral body, and then in between there, there's a space, and that space is where there's a disc. Now granted, this is a lumbar or low back model. This is not the neck model, but it's the same type of anatomy where you have a bone, disc, bone, nerve in between, spinal cord down the middle. So in between here, you cannot see a disc on x-ray. You can see the shape of where the disc exists. You can get an idea of the quality of the joint. You can get an idea if there's osteoarthritis, which is the most common type of arthritis that you hear about when you see, commercials talking about various drugs and things to take to mask symptoms. They're talking about osteoarthritis. It's the most common arthritis. It's something that happens due to mechanical joint stress. So it's like if your tire on your car is out of alignment, it wears out quicker because there's unneeded mechanical stress to that tire. Same thing with the spine. If you have an abnormal alignment of a curve, you have abnormal mechanical stress, and it causes a joint to break down prematurely. Okay, so now with that said, we have bone, disc, that's what we're looking at, and we're looking at the curve. We're looking to make sure all the bones are nice and square, and making sure that these spaces in here are nice and thick and that it's uniform throughout. There's a lot of other little details to look at. We look at spacing in between these, which are called the spinous processes. We're looking to see if any of them are flared out too much in this neutral position. Neutral meaning just looking straight forward. So this patient was basically x-rayed like this. They're standing sideways just like this, and we shoot an x-ray right through like this, okay? They're not looking down, they're not looking up, they're looking straight forward. All right, so that's a normal from the side view. Let's see, if we look at this one right here, over on this screen, this is a full spine x-ray, okay? And I'm gonna zoom in a little bit here so we can look at the neck. And this one, you can see is not so normal. There's a big curve here in the upper back area. If we just took an x-ray from here on up, you'd say, oh, there's a little bend up top. Maybe that's an abnormal alignment. If you went to your primary care doctor, nothing against your primary care doctor, but if you went to them and they just took a cervical series x-ray, like a front view of the neck and a side view, and they didn't include the foundation of the neck, which is your thoracic spine down here, you'd only get a piece of the puzzle, and you wouldn't realize that this little bend up here is compensating for actually a slight scoliotic curve or an abnormal curve down here in the thoracic spine. So the importance of not just looking at a small x-ray, but actually analyzing the spine as a single continuous unit is very, very important. And that's something here at our clinic at Gonstead Spine and Wellness out in Meridian, Idaho. We take full spine x-rays on the vast majority of our patients because we will typically have findings in multiple areas, and we want to look at someone as a whole and not miss anything. So very, very important to not just look at where it hurts or where a symptom is, but to analyze the whole structure, okay? So now let's switch gears and let's look at a abnormal curve. All right, so I tracked down a abnormal curve just to show you what it looks like. This is when someone has lost all their curve completely. Up here, our fancy software helps us calculate. This is stuff we used to have to mark by hand. Now we get to blow this up on a big screen and identify points with some fancy systems, and we get really accurate measurements so that we can understand what's going on with our patients. And in this case, you should have a 30 to 40 degree curve in the neck, okay? So a 30 to 40 degree curve, just to break that down, because I know sometimes when people hear degrees, it kind of like, oh, you lost me at degrees. Here's how it's measured. If there's a line on the back here from C7, that's the lowest bone in the neck, there's 7 cervicals in the neck, so 7 bones. Number 1 is up here, 2, 3, 4, 5, 6, 7. We measure the curve from C2 to C7. So this back border here is called the posterior tangent line. So it's essentially a point on the back of the vertebral body. And if we could extend this line up like this, okay, and then imagine we had another straight edge and we could extend this line, and then you intersect those 2 lines, or you measure the angle between those 2 lines, you have a 1.8 degree angle going in the flexed position, meaning the wrong way compared to where it's supposed to be. So if you're supposed to have a curve like this is 0 degrees, this is reverse 1, 2, 3, 4, 5. This would be a reverse curve now in the neck. Okay, so now this patient, this is someone that actually got in a car wreck. So side note, whiplash is not a diagnosis. Whiplash is a description of an event that happens. A diagnosis is a spinal instability or a spinal ligament injury or a specific sprain to certain ligaments or joints in the neck. So just in case if you've been in a car wreck and someone says, oh, you have whiplash, that's not a diagnosis. That's unfortunately just kind of a lazy way to say that here's what happened to you. It's very important to identify exactly what segment was injured so that it can be rehabilitated and fixed properly so that you can avoid a lifetime of problems. So now in this case, this is a patient that was in a car wreck, should have a forward curve, lost it. This is 104% loss compared to normal, still fairly normal discs. Okay, so young patient in her 20s. If you took her and didn't address this curve, there's a very, very high probability, and the studies show this, that her neck would break down prematurely, that it would become arthritic prematurely, that she would have all kinds of issues. There's even a study done that shows that a 0 degree curve compared to other patients that had curves, that this has an 18 times increased odds ratio of having chronic neck pain. So essentially there was a study that was done where they just looked at x-ray curves and they tried to predict who in that study had pain, and they found that the closer you approximated to losing your curve or having a reverse curve, the instance of having chronic neck pain went up significantly. So it's very, very significant for this. Yes, there's outliers. There's people out there that might have no curve in their neck and have no pain at all. We see them. They come in here as patients and they come in for low back pain, and we find a problem in the neck and we take a full spine x-ray, we analyze the neck, and we point out to them that even though you came in for low back pain, structurally the worst thing in your spine is your cervical spine, and then we address it. So anyway, this is an abnormal side view of the neck. I'm going to show you something else that we do. So let me pull this up, and this is a different person, but I'm going to pull this up where this one over here, this is now an extension x-ray. So what does that mean? That means this is neutral, looking straight forward, right? This is extension. So we have someone extend back as far as possible, almost to the point where it might hurt a little bit, because what we're doing on that view is we're trying to stress the spine. It's called a stress x-ray. We're stressing the spine to see if there's any sort of potential failure, subfailure issue to the ligaments that connect the bones together. Now, what do I mean by that? First off, ligaments connect bone to bone, okay? Tendons are different. Tendons connect a muscle then to a tendon to a bone. So here around the spine, we're talking about spinal ligaments. The disc is a ligament. This is the ligament everyone talks about. This is the one you go get an MRI for and everyone thinks is the most important ligament in the world. However, there are 10 ligaments that connect each bone to the next in the spine. Mind you, this is a lumbar, low back model, not cervical spine model. Similar anatomy, that's why I'm using it as an example, and I don't have a cervical spine model to show you that moves like this. So what happens is there are 10 ligaments that connect one bone to the next in the neck and really everywhere in the spine, except for the upper cervical spine. That's a little different, but let's not go off on that tangent right now. And what happens is when you have a trauma, you can stretch and tear ligaments, and you won't find that on MRI. MRI misses it because MRI is looking for disc and pretty much disc only as far as ligament for the most part, okay, in the standard MRI. The way you determine if there could be a spinal ligament injury, which is an extremely important thing to be able to check on, is by doing a stress x-ray. You do a flexion x-ray and you do an extension x-ray. This is an extension x-ray of another patient that we took care of that was in a trauma. She had a neck trauma. She came in, she had headaches, she had some numbness into her arm. Those were her symptoms. Also a younger patient. I'm showing you all younger patients right now. She's in her 20s. The discs look pretty good, meaning they're thick. There's not significant osteoarthritis, there's not significant thinning, the bone is fairly square, so her problem is alignment. It's not problems with the bone or the disc primarily, at least looking at the x-ray. We actually sent her off and she had an MRI in conjunction with this, and she had some mild findings on MRI, small disc bulges at a couple of levels. But I want to show you why this is so significant, because this is ultimately what you have to have done if you want a proper cervical spine evaluation and x-ray workup. You cannot just do a side view and a front view and say that you're good. If you want to evaluate the integrity of your neck, you have to do bending x-rays, flexion and extension x-rays. This is the extension x-ray. What should happen is when the spine or when the neck bends forward, the vertebra should not slide forward. Okay, there's a very small amount of movement that is acceptable. It's a fraction of a millimeter, so a millimeter, very small, right? When you extend backwards, the bone should not slide backwards more than a fraction of a millimeter. When you add those up, okay, so you say, how far does it move forward? How far does it move backwards? If you measure that, you add it up, it should be less than 1 millimeter. More than 1 millimeter starts to become an issue. More than 3.5 millimeters is a significant rateable injury, meaning it has significance as far as predicting future outcomes for the patient, as far as disability, as far as if it was something that happened in a car wreck. It's significant evidence that would support and protect you as a patient so that you can prove, yes, I'm injured, and here's why. And these are based off of American Medical Association guidelines in a impairment manual, which, this one right here, okay? So this one right here. So this is actually in the AMA Guides to Evaluation of Permanent Impairment. So this is based in the American Medical Association as far as looking at these amounts of movement. It's called alteration of motion segment integrity. We can do a whole other video just talking about that, but I have to mention it if I'm going to be thorough in this video. When this patient is extending backwards, if you remember what I said, exceeding 1 millimeter, when you add up bending forward, flexion, and bending backwards, extension. If you exceed 1 millimeter, when you add those up, that's a problem. So what does it mean if you exceed 1 millimeter in just extension? Is that a problem? Yeah. So this measures how far these are shifted. And if you look at this, it's 3.6 millimeters at C2. Is that a problem? Significant. Okay, 3.5 millimeters when you add up both movements is a problem. This is only one movement, one direction. It's already exceeding that 3.5 millimeters. And it's not just at one segment. You have this one, 3.3 millimeters, so it's pretty close. If we look at the forward bending one, it slid forward a couple millimeters as well, so this level of the spine is also in instability. It's moving too much. This one, 3.3, same story. 2.5, a little bit less, but in a normal patient, if we didn't have all these other findings, this would already be a little bit of cause for attention. And then 1.8, still a little bit lax, but less, okay? So this is another way that we evaluate what's going on with someone's spine as far as normal versus abnormal. So last thing I'm gonna show you is I'm gonna show you an x-ray briefly of a patient that didn't get this stuff fixed, and then it became more arthritic, more problematic, and you can see what it does to the bone and what it does to the disc space. All right, this next x-ray I want to show you, this is a older patient of ours that has significant osteoarthritis. In theory, should have seen us 60 years ago. So this patient's actually 80 years old. She's in pretty darn good shape for 80 years old. She's very active and healthy in many ways. However, she has some neck issues for sure. And this is the primary reason that she came in to see us. But here's a really, I think, telling thing here. So first off, excuse that there's earrings on here. This is something that is like a big no-no on our team. We never have earrings on, but we do put these metal markers on our x-ray. This here is a BB, and BBs are placed on someone's spine. In this case, it was up top because that's where we had an exam finding. We use that to correlate where we find the problem on the patient to where we see it on the x-ray. And so now, and I'm just explaining that so you know why there's these two weird looking things. There's earrings, here's a BB. Besides that, let's look at this. Based on everything you just learned so far, is this a normal forward curve of the neck? No way. It's completely reversed, it's going the wrong way, and then it tries to come forward at the very, very end here. This measures as a reversed 14-degree curve. So 134% loss of curve. That is significant, that's quite a bit. But another interesting thing, she went to her medical doctor, and her medical doctor did a workup on her neck, and they said, oh, you have this because that's just part of the aging process. That's just osteoarthritis. Now, here's a very easy question to go back and ask to pretty much prove that this is not just part of the aging process. Okay, because a side note, we have patients in their 20s that have arthritis that we're already seeing. I mean, heck, we have patients that are teenagers that already have arthritis starting in their spines. And we have patients in their 70s and 80s that have better looking necks than 30-year-olds. So how could that be? It's because the problem is not the aging process. The problem is having a mechanical problem with a joint and then adding time to the equation, right? So you injured it, you didn't get it fixed properly, no one knew about it, and then you let it progress in age for 20, 30, 40 years. So in this case, this disc up here, how's that look? Almost perfect as far as disc space. As far as bone quality, look at that bone. Nice and square, all the margins are very clean. The top of C3, same thing. Okay, very decent, bottom of C3. The alignment's not good. C3 is shifted forward. It's translating forward, which is a type of instability. But as we go further down, this is what they were referring to as far as the arthritis and part of the aging process. Very hard to even discern a disc between these two segments. The bone has changed its shape quite a bit. All this whitening here means that the body has increased calcification, it's increased bone density as a result of increased stress. Same thing at C6, C7, that disc very thin and broken down. There's little bone spurs here starting to happen, which are called spondylophytes. And down here trying to bridge over and essentially lay down claws and attempt to fuse, just looking for any form of stability to a neck that is struggling. And so now this patient, this is a perfect example of what oftentimes and very well can happen when you have abnormal alignment at a younger age, and then you either don't know about it, or more importantly, you don't do anything about it, and you allow nature to take its course. This is a very predictable path. Now again, I'll say, are there outliers? Are there people that can have no curve in their neck and for whatever reason they just don't suffer from those same issues as far as that mechanical stress causing the bone to break down at such a rapid rate and being so arthritic? Surprisingly, yes, but it's extremely rare. Now, I've practiced now for 18 years, looked at thousands and thousands of x-rays, and so this is the norm of what we would typically see in those scenarios. And this is, for the most part, preventable. And it's preventable in the sense of making sure you know what your normal neck alignment is as soon as possible. All right. So that's pretty much a summary of what I wanted to cover as far as neck alignment. There are plenty more details we can go over just with the upper cervical spine, because the upper neck is a kind of a separate animal in and of itself. But for the sake of this video, which is already long enough and detailed enough, These are the basics of what you need to understand. So if you're suffering with neck pain or headaches or tight neck muscles, or you just want to maybe get a better grip on what's going on with your spinal health and your cervical spine health, then this is what you need your doctor to be looking for. And so now keep in mind, we serve two different audiences. One of those is our patients that we take care of here in Meridian, Idaho, right outside of Boise. We have patients that we take care of locally that drive or fly in from out of state for this unique approach. But the other audience are the chiropractors that we teach our systems to, primarily functional movement and corrective exercise, which is a key piece to how we help fully address and fix these types of issues as best as possible. All right, there you have it. That is everything you need to know about the cervical spine minus the upper cervical spine. We'll have to do another video on that in the future because there's a lot of details just with the upper neck as well. But as far as with most neck issues that you're gonna see or experience for you or your loved ones, the stuff that I covered in this video right now, this is what you wanna make sure your doctor dives into and understands in its entirety. So with that said, let me know what questions you have. What type of neck issues do you have? What things have you been diagnosed with? Have you had surgeries? Have you done other treatments that have worked well for you, haven't worked well for you? What else can I clarify? Please leave that in the comments below, because ultimately we want to interact with you. We want to make sure that we are getting information, quality information to you, for you, and for those that you love and care about. So something that we say here at Gonstead Spine and Wellness, which I think just carries over to everyone, is that when it comes to the health of you and your family, results matter the absolute most. So thank you again, Dr. Todd from Gonstead Spine and Wellness. We'll see you on the next video.